So welcome everyone to the February Talks on Tuesday. We are going to talk all about self-care today. So my name is Lisa Terry. I'm an early intervention professional development consultant with the VEIPD team. We also have with us joining Seth Buffkin. He is our tech support and he'll be providing all the background support. If you need anything, feel free to message him and reach out to Seth. We also have Lorelei, who is joining us from our team as well, and I believe Corey Hill. So they're there and they'll be in the background too. We do have closed caption that is turned on. So if you would like to access that, please feel free. If you go to your toolbar, you should see a button that says captions. You can also hit more if you don't see it, and you should choose the option for captions to turn them on if you'd like. Today, we will be using the chat feature as well as the stamp feature. And then Corey and Patty are also going to be putting us in some breakout rooms too for some fun activities. So we are super excited about this topic. They also presented this at Creating Connections to Shining Stars last year, and it was really phenomenal. So we're excited that they're able to bring this here to our talks on Tuesday. And I'm going to go ahead and pass it on to them to go ahead and introduce themselves.
Thank you, Lisa. It's nice to be here today and presenting the session because it's one that's close to my heart and definitely very relevant for our times and where we've been the last few years. So just to get us started, I'm going to introduce myself. My name is Patty Eitmiller. I work for the city of Alexandria up here in Northern Virginia. And professionally, I spent over 15 years as an early interventionist, as a developmental therapist, and often also a service coordinator for our early intervention program. And for the last 4 years, I've also been doing professional development and training, primarily with our family day home childcare providers, our center-based programs, as well as our early intervention programs and other early childhood programs within the city. So I do a lot of professional development. I've been lucky to have had some wonderful opportunities to work with Lisa and Corey and the VEIPD team. So just to get us started, I'm going to talk a little bit about, and we're going to talk about self-care, but just to help to identify how I participate in self-care. Some of the 3 ways that I participate in self-care are I practice yoga regularly, or try to. Haven't been as consistent, but pretty consistent in January. February I didn't start off so great. Been a little busy. I also like to read for pleasure. One of the things I like to get into before I go to bed just to relax my mind. And one of the things I really was consistent about, particularly at the beginning of the pandemic, is taking walks outside. After all that time inside, I really needed some sort of fresh air, some sort of change of pace and change of scenery during the pandemic, and that stuck. So I do like to walk, though this time of year, I will say it makes it challenging because it gets dark so early at the end of the day. So I'm going to pass it on to Corey so she can introduce herself as well.
Thanks, Patty. I love that Patty has this Zen emoji and I have like this I'm out of breath dying emoji. So it probably tells you how much work I need to do with self-care and why this topic is so interesting and intriguing to me. But I'm Corey Cassidy. I'm a professor at Radford University. I also have a faculty appointment and work with the folks at the Virginia Tech Carilion School of Medicine. I've been a licensed speech language pathologist and have provided services to young children and their families for more than 25 years now in multiple states across the country. And I teach and engage in clinical work and scholarship in the areas of early speech, language, and communication development and disorders. I also focus a lot of my time and attention on interprofessional education, collaboration, and leadership in and across the health sciences and systems arenas. So I've been working in a position that is focused more on administration for the past several years, and it's been quite stressful. And so some of the impetus for putting together this presentation with Patty was to figure out how to calm my brain and support my body. But I'm so excited that I'm going to be spending the next year authoring a textbook with a focus on best practices for the SLP in early intervention with Plural Publishing, and have big plans to return to the classroom and begin a new clinical program with my grad students in our community childcare center in August of this year. So again, one way that I'm really taking care of myself is thinking about what my priorities are and where I find my joy. I also have a lovely husband, Jim, who's a registered nurse, and 2 young, now school-age children, Augie and Olive. And they are all amazing. I'm very fortunate. They're also exhausting. And so, to be honest, as I said, I've not always been, and I'm still not the best at practicing self-care, but I have a few strategies in place now that have been working for me, and I'm excited to share those along with some others with all of you today. So I'm going to hand it back to Patty, and we're going to show you a little video.
Thanks, Corey. And while I would love to show this whole entire video, Lisa's going to take us to just the 3:16 mark. So we watched just about a minute. The whole thing is pretty funny. So if you want to see the whole thing, we can drop the link later to you. But let's go ahead and watch.
For work tonight if we had anticipated a decompression, but in the event of a decompression, 4 saffron yellow buttercup masks designed by Gucci and Martha Stewart. Well, they're going to drop from that compartment overhead. To start the flow of oxygen, you have to first stop screaming. You let go of the person next to you. You reach up, grab that mask full, extending the plastic tubing, place it over your big nose and mouth, and continue wearing that mask until otherwise notified by one of your 4 fabulously dressed flight attendants. As the flight attendants that you'll see running about our cabin absolutely naked tonight, folks, they just simply cannot be trusted. Now, ladies, for those of you traveling with someone that's going to need your assistance this evening, ladies, yeah, you know exactly who I'm talking about. Yes, ma'am, that very dear husband of yours. Dear, when those masks fall, you may want to sit back. Think about it for a bit. Diamonds, diamonds. For those of you traveling with your children, why? And for those of you that are traveling with 2 of your children, what in the world were you thinking tonight? But when those masks fall, put the mask on the bright one. That one's going to contribute to your retirement most successfully. Ladies and gentlemen, do us a favor this evening. Thanks for coming out and joining us on the holiday weekend.
So pretty funny. So the whole point of when you fly, and if you've flown on a plane, you know they always go through that spiel of making sure you put your mask on first. You put that mask on yourself first to take care of yourself first before you take care of those with you, such as children, or like he said, your husband or your spouse or whomever else that might need assistance. So we want to think about that tonight, taking care of tonight, gosh, I don't even know what time of day it is, taking care of yourself first before we take care of others, because that's really the whole premise of self-care. So when we talk about self-care, you're going to see the definition there on the screen. And I'll read through it as well, but self-care is not self-indulgence. It's not about being selfish. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. So that sounds like a bit of a mouthful, right? The important thing is to remember that self-care is not about self-indulgence or being selfish, right? It's right there on the screen, and I feel like I need to say it a couple of times. Sure, I know many of us think that taking time to go for a walk or read a book or practicing yoga or even getting a massage is an indulgent, as it takes away from those other demands in life. But as I've told parents that I've worked with for years when I was in early intervention, taking those moments to take care of oneself often makes us healthier to be able to help support and take care of others, such as our loved ones and the children we care for, the children we're working with, which leads me to why self-care is so important. So, Lisa, if you can go ahead and check it to the next slide, please. Thank you. So why is self-care important? Is it a state of mind? Self-care promotes those positive health outcomes, such as fostering resilience, living longer, becoming better equipped to manage stress. Self-care can look different for everyone, but to count as self-care, the behavior should promote your health and happiness for you. So as I just mentioned, practicing self-care activities not only benefits ourselves, but helps us to maintain healthier lifestyles. It impacts our ability to interact with those around us and care for our loved ones. Additionally, as noted on the screen, again, it fosters resilience, living longer, and being better equipped to manage stress, which we're going to talk about a little bit more in a bit. Common examples of self-care including maintaining a regular sleeping routine, eating healthy, spending time in nature, doing a hobby that you enjoy, expressing gratitude. And one of the things that I guess when Lisa asked if I did a New Year's resolution, I kind of did set one, disconnecting from technology for a while. I mentioned during our practice 2 weeks ago that I disconnected from my phone for 36 hours one weekend, which was absolutely amazing, hard in the beginning, very amazing. And I've kind of committed to trying to disconnect one night a week overnight for 12 hours to just disconnect the phone, turn it off, and be able to take care of myself. It's amazing how reliant I know I've become on technology and how reliant many of us are. And when we take it out, it really is a form of self-care. So it's important to remember that self-care can look different for everyone. It can also look different for yourself from day to day. We have days, we have weeks, we have months that are even more stressful than others, and the need for self-care can become greater during those times. Think about the last nearly 3 years of this pandemic. Given all the changes and everything that's transpired around the pandemic, we've all likely felt a lot more stress than we've ever felt before. Our worlds were rocked in a sense that we needed to ensure that we were participating in regular self-care activities, and that never became more important to us than it did in the last few years. In the light of all the changes in the last 3 years, Corey's going to share a bit about the history of self-care and how it evolved.
Thanks, Patty. So, all right, there's my slide. So what is the origin of the concept and term self-care? So we took a deep dive to see where this all started and how much of a fad was it. And it turns out, believe it or not, the history of self-care began in the 1950s and grew in power and popularity through the civil rights movement. So today it's a well-known term, and it means, as Patty said, taking care of yourself and doing what's holistically healthiest for yourself on any given day. But it hasn't always meant that. And knowing its history helps frame its significance in today's context, especially, and really it's just honestly interesting. So let's go through some of the decades. So the ideology of self-care originated in the 1950s in the medical community. With the rise of patient-centered medicine came a greater emphasis on individualistic acts and practices that would improve the health of patients. This introduction of patient autonomy to healthcare gave birth to the first ever self-care movement. The term self-care was integrated into medical ethics teaching and used first in mental hospitals for institutionalized patients. So encouraging patients to practice self-care in order to regain self-worth was the original emphasis. And tasks as simple as exercising or personal grooming or even learning to eat well actually came from the medical world. In the 1960s, self-care became a widely adopted idea. It soon became a widely adopted idea in medicine, although only embraced in these specific psychiatric settings. But it was an idea in the 1960s that became a core part of community care during the civil rights movement, thanks in large part to the Black Panther Party. So known for promoting social justice and change, the Black Panther Party used the radical idea of self-care to fight against systemic racism. They had an understanding of the important role self-care played for the rights of women, the rights of Black people, and those of marginalized communities at large. And in order for them to keep up their momentum, the Black Panthers realized they needed to take care of their own group. And so by encouraging acts of self-care among their members, the movement could stay energized to fight for justice. As we enter into the 1970s, the history of self-care overlaps with the increasing awareness of equitable healthcare and medical racism. The Black Panther Party helped pivot towards justice-based medical ethics. So combining the 1950s and the 1960s movements in health and self-care, we now enabled community access to equitable healthcare through this concept. This was a pivotal time, let me say that again, a pivotal time in the self-care movement. And it's fascinating to me that the history of self-care began as a part of Black history, but it would soon become a holistic approach with widespread adoption by many. Plus, this pivot from a community center initiative to a medical necessity for everyone would help frame self-care as a health and wellness term in the future. So carrying forward the ideas started in the Black community, Audre Lorde was a prominent activist for self-care in the 80s. And in many ways, Lorde brought a seat to the table for Black LGBTQ+ voices on the topic of health and wellness. In 1988, she wrote famously, "Caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare." Their contribution on the topic of self-care, however, was really only recognized by smaller marginalized communities. And though their work was prophetic and hugely influential in the decades after they died following a 14-year battle with cancer, it would not be until the 2000s that the idea of self-care would get the attention it deserved. So let's go ahead and flip slides and we'll move into the 2000s. So as we do that, the decade of the 90s is remembered as a time of economic boom and political peace after the decades-long Cold War ended. While it wasn't all roses and butterflies, it was not also a time of revolution, uprising, or significant social change. But as we moved into the 2000s, specifically after the events of 9/11, our nation was thrust into a new era of self-reflection and belonging. The term self-care underwent major redefining at that point. The 9/11 attacks brought unprecedented devastation and loss, and as a nation, our collective understanding of post-traumatic stress disorder, PTSD, changed. The attacks sparked a new movement of trauma therapy for veterans, victims, and first responders, and in the years following 9/11, the term self-care rose to new prominence. Psychiatrists and therapists began using the term with trauma victims. Versions of this therapy-centered self-care approach were shared with the larger American public as a way to regain resiliency after this nationwide earth-shattering event. And this was all followed just a few years later by the economic recession in 2008. So these events are key plots on the historical timeline of self-care and its integration into the American health and wellness dialogue. The hashtag self-care was first published on Twitter in 2008. With the election in 2016, the term self-care exploded. So 8 years after it was published on Twitter, it exploded at that point. And for 6 days post-election, the term self-care saw a spike in search interest in Google. Articles with self-care in the title were being published regularly in the weeks after the election. Self-care became a nationally recognized necessity somewhat overnight, or so it seemed. Since then, self-care has gone viral as a much needed and encouraged practice for everyone. It's come at a time when mental health awareness and need is on the rise. The 2010s, in response to much of the trauma of 9/11 and the economic recession of 2008, are responsible for the mainstreamification of self-care. And it's grown out of its beginning days of re-energizing activists to become a widely adopted and widespread term. And just to put this in perspective, this was all before the pandemic hit in 2020. So we're going to get back to some of the research, and I'm going to hand it back over to Patty.
Thanks, Corey. That every time you go through the history, that just amazes me how long self-care has been around, and it has been part of our culture, and the ways it was integrated in different parts of our culture as well. So when we talk about the research, there are not a ton of articles about research or self-care in the research per se. There are several articles as it relates to early childhood professionals and teaching, and they're noted in your handout, which hopefully you got when Seth sent out the links. But we can make sure we drop that again in the chat. But the one thing that I want to note of the articles that are out there is that common phrase of those that take care of others often take care of their own needs last. How many of you can relate to that? I know I can. Most of us got into this profession as early interventionists, or early childhood special ed teachers, or caregivers, or childcare providers, or something related to early childhood because we enjoy caring for children or working with children or working with their families. So one of the articles that was really poignant that really did relate to the early childhood professionals and self-care, I'm going to pull out some points that are also on your screen, but they talk about teaching-related stress. I can't even talk today. Teaching-related stress that can be triggered by burnout. And I know all of us have probably experienced some level of burnout in some points in time in our career. And if you haven't yet, bless you. I think that's wonderful. But I think a lot of us have probably experienced some feelings of that nature. But also absorbing secondary trauma conditions, particularly those that work in special education or early intervention. We are often encountering children and families that are going through some sort of trauma. And it's hard for us as we get encroached into their lives and become a part of their lives, not to feel some of the effects of that trauma ourselves and bring that home with us. So that's what they call a secondary trauma. And that can happen to anyone, and we absorb it as part of our lives. And then that compassion fatigue, which kind of goes along the same lines with that, is that you are compassionate about what those families are going through. And when you bring it into your life and your own well-being and your own mentality, that does make you tired having to manage that as well. So preventing some of that secondary trauma, that compassion fatigue, can be addressed through some self-care strategies. And Corey's going to talk a little bit about why self-care matters next.
Yeah, so first I want to hand it back to you guys. So let's go ahead and type into chat and answer this simple question on the screen, simple or complex, depending on how you see it. Why does self-care matter? So Patty and I are going to be quiet for about a minute and we're going to check out your answers. So go ahead and type into the chat why self-care matters in general, or why does it matter to you? Kelly got us off to a really strong start because we're important as humans. Great. And several folks have already said it's better to take care of yourself before you can take care of others and burn out, to be our most effective helpers. That's right. We have we're helpers, right? We're service providers. And we can't help ourselves if we can't help others, if we can't help ourselves. Yeah. Shirley, I love that. Yes, because you matter. Stephanie, thank you. Yeah, to make you a better wife, a better mother, a better sister, a stronger daughter, a helpful therapist, right? One who can provide therapy to others. Missy tends to run herself into the ground and realizes she hasn't taken care of herself. So before it's too late, yeah. We want to make sure that we're taking care of ourselves and regroup. That's right, Cassidy, to regroup, to be better at what we're doing and to be better to the others for whom we're providing our services. Okay, well, guys, keep putting those thoughts and comments into chat. I think we see some really good themes. One of the things that people haven't said, although it's been implied in all of these, is because if we're not taking care of ourselves, we find ourselves stressed. We find ourselves stressed out. Patty talked about being burned out, right? If we let the stress get the better of us, we burn out. We can't take care of others if we're stressed, if we're dealing with stress and stress-related issues. And we're going to talk a little bit about that in a minute. But everybody feels stressed from time to time. Some people say they feel very stressed most of the time. Missy, I'm a little worried about you. You might be one of those people. And while stress isn't always bad and can even be helpful, too much stress can affect our well-being and our long-term longevity negatively. So stress comes up when we feel the demands of a situation, an event, or we work a lot or too much, and it's too much to manage. It can be stressful to manage the demands at work, to manage relationships, to manage finances, to deal with unfair treatment, to manage long-term health problems. And some of you have mentioned some of those things. Yes, Missy, my family likes me better when I take care of myself. Yes, it can also come up in response to a specific event, or it can have a negative impact on those around us, and major life changes or even regular routines can really have an impact. Changes in a relationship and a housing arrangement, in our jobs, in our sources of income. As stress is based on the way that we see and react to a situation or event, the events or situations that cause stress are different for different people, and we all respond differently to those things. So, and interestingly, there's more than one type of stress. So I'm going to hand it back to Patty to talk about each one of those with you and to talk a little bit about how you respond and react to stress and what impact that has on you.
Excellent. Thanks, Corey. It's a nice lead in right into stress, because stress definitely goes hand in hand with self-care. So as you can see up on the screen, we've defined the 3 different types of stress, and you may be aware of these. You may have felt all of these at certain points in time in your life, but we do have 3 different types of stress. That positive stress is those normal life experiences. They're not dangerous. They're not threatening. They're often short-term, and we can cope with them with the support of loved ones, those around us that provide that support. We are able to get through that positive stress. It's a part of our lives, and it's a part of our lives that's going to continue to be in our lives as well. Then when we have the tolerable stress, that tolerable stress is more long-lasting. It can be more intense, but it can still be relieved by those supportive relationships in our life. So those people that we rely on when we're feeling like the world is just a little too overwhelming, that tolerable stress can still be something that we can exist with quite successfully and quite healthily. Examples of tolerable stress could be things like moving into a new home, getting a new job, things that most of us go through some point in time during our lives. But without those relationships, those supportive relationships, that tolerable stress can then become toxic stress. So if we don't have those support systems in place, then that tolerable stress, those things that we're going through, can then become more toxic. And toxic stress is more events that are continuously activating your stress response system without any protection or comfort. Those stressors that could be typical of toxic stress could also be recurrent abuse and neglect, severe depression, substance abuse, family violence, ongoing effects of living in poverty, those events that are really, really targeting that stress response system, and nothing is helping us to be able to release that stress. It also could give us relate to us having the ability to not be able to pay attention as well, because we're more focused on threats or danger or things that are going to continue to feed into that stress. So when we think about the long-term effects of stress, and Lisa can go to the next slide for me, hopefully. There she goes. So I'm going to just kind of leave this screen up here to kind of explain it to you. It can go all the way up to early death. So those of us that experience toxic stress pretty continuously for our lives, it can certainly impact your health to the point that it could be detrimental to your health. It also can cause high heart rate. It can cause high blood pressure. Your stress hormones are going to be a lot higher. And then it also, as for children that are experiencing toxic stress, so there's children that are in your care or the kids that you're working with and the families you're working with, it can also impair their brain architecture, their immune status. Their immune status might be more diminished. They might get sick more often. You might get sick more often. I know many of us could say that when we are feeling more stressed, you're probably more apt to come down with a cold or get sick because your immune system is working harder to be able to counteract those stress hormones that are going on. Your metabolic system and your metabolism might be poor. How many of you have gained weight because you have been really stressed? Totally me. Can totally explain, can relate that to stress as well. Same with your cardiovascular function can be impaired as well. So to go ahead and move on, we're going to talk about, Lisa, you can go ahead to the next slide. How does stress impact you? So we're going to use the stamping feature in Zoom, and Lisa might come on and explain that so you guys know what to do.
Yep, I can do that. So you want to go to view options on your screen and annotate, and then you can choose a stamp and drop. You'll see like a star or a heart. Pick whichever one that you want, and you can drop a stamp on which part really and how stress impacts you the most. And if you can't figure out the stamp tool, feel free to type it into the chat.
And as you do that, if you want to share, if you're so inclined, please feel free to share how specifically stress impacts you personally. So I see lots of folks are, oh, now the stars are everywhere. I see I saw first a lot of physical responses to stress, but I'm also seeing behavioral, mental, emotional, right? All of the ways. And that's pretty accurate, right? Some people might be clicking on one and then clicking on the next. All four, Sally says all four, absolutely. I don't think I could pick just one, Sally. We don't make the best choices sometimes behaviorally, emotionally, certainly. We get in our own heads mentally, and then physically we feel the pain. All four, yeah. I think everybody could probably click on all four. So go ahead and, if you will, Lisa, go ahead and shift the screen, but people are welcome to continue to share their thoughts in chat.
I will do that. And if everyone can just hit the X out of the annotate bar so we don't keep getting some stamps up, and then I'll have Seth clear the screen.
I was going to say, you can just keep decorating the screen. I think it's lovely. It's kind of a stress relief. It's like confetti on the screen. So how do you respond to stress, right? We've been talking about that now. We're all impacted by stress in different ways. And as Patty shared with us, there are different types of stress. One that is actually even considered positive. We find ourselves surrounded by stressful situations, many of which we may not have control of every day. Certain days of the week might be more stressful for you than others, certain times of the year. How we respond, though, is what we really want to focus on and is more within our control. So Patty's going to go ahead and talk about triggers and how to recognize stressful factors, and then what we can do with it after that.
Thanks, Corey. So When we talk about, Lisa, you can go to the next slide. There you go. Thank you. When we talk about stress, there is, and those of you who've been in trainings with me before or been on any trainings related to behavior, we know that there's a meaning behind every behavior. Stress is very similar. There is a meaning behind the stress that you're experiencing. And when we think about what that meaning is, it can be identified as triggers. So we all have them. We all have things that trigger us, whether it's people, places, events, experiences. They all trigger stress. And I know I can think of several on very easily, things that just trigger me. But take a minute to think about some triggers that you have. And then we're going to put you guys into breakout rooms of 3 to 4 people. And you're going to have 8 minutes to discuss and share those triggers with the people in your breakout room. So go ahead, and I think we can go ahead and move to the next slide and put them in their breakout rooms. Look at that numbers jump back up. Looks like everybody is back. I hope you guys all had some good conversations in your breakout rooms. We were chatting while you all were in there, and I was just saying that the worst thing about being in a breakout room is being cut off and kicked back to the main room, mid-sentence. So hopefully if that happened to you, you got to share some of your triggers with the people in your rooms with you. But when Corey and I did this session in person last summer, we found that those opportunities to talk with some of our peers in these smaller groups, particularly around this topic, tend to be really, really healthy and a good form of self-care, because it gives you a colleague to kind of chat some of your triggers with and some of the ways you manage those triggers. So we can go ahead to the next slide, Lisa, please. So now that we've learned about the history of self-care and why it's so vital to our general health and wellness and the ability to do all the things that we want and need to do, let's talk about what it looks like for the individual. So we're going to share some different strategies with you today. Please know that everyone is different and that some of the things that we will try together may work well for you, while others maybe not so much. I encourage you to participate in practicing any and all of these strategies that you feel comfortable trying. And please do not get discouraged if you don't have immediate sense of relief or relaxation. Just like any new skill or any new strategy, self-care takes practice as well. So we can go ahead to the next slide, and we're going to start off by talking about the 7 types of rest. So when I first saw this and started reading about this, I had no idea that there were 7 different types of rest. When we think of resting, many of us think about it as taking a nap, getting a good night's sleep, or maybe lounging in your backyard in a lounge chair or a hammock. I know I was surprised to learn, like I said, there were 7 different types of rest, and that each type is just as important as the other, and it helps us to restore and recharge different areas of our well-being. So let me go through and kind of define all of them each briefly, and they're all listed on your handout as well. So the first is physical rest, which contains 2 components, active and passive. Passive rest is what most of us think of when we imagine a rest, like napping, sleeping, or lounging around. Active rest includes things like Corey and I do, practicing yoga, stretching, getting massage. I had one of those this weekend. It was fantastic. And activities that allow our bodies to feel rest and to feel nurtured, like we're actually taking care of our physical body. You also might need a mental rest, like kind of those things when your thoughts are racing, when you lay down to go to sleep, or if you're like me, you walk into a grocery store and you can't for the life of you remember those 3 things that you were supposed to go in the grocery store to get because you've got so much going on in your mind. Examples of this type of rest could be taking short breaks throughout your workday, keeping a notepad beside your bed to jot down those nagging thoughts, or your to-do list. And I am a huge to-do list person. Those that know me know that I love making lists of things to do so I can mark them off. That is a kind of mental rest for me as well. We also talk about sensory rest. And I mentioned earlier during this session that I have started taking some breaks from my technology, turning my phone off for 5, 6, 7, 12, 36 hours at a time, because that's giving me a sensory rest of getting all that sensory input a break, all the screen lighting, the fluorescent lighting, but also taking a sensory rest from like the loud honking horns, everything that's going on in the environment, your loud kiddos, your kiddos running around, whatever it might be. Anything that we can do to counter that sensory overload, even if it's just closing our eyes for a moment in the middle of the day, to intentionally unplugging our devices 30 minutes before bedtime can help address that need for sensory rest. So then creative rest. That's one I hadn't really considered a whole lot. It's a really important area of rest, especially for those that have to solve problems or brainstorm new ideas. For some people, this type of rest might include painting or drawing or engaging in another creative activity. For those of us that aren't so artistic, it can engage in rest by we can engage in this type of rest by taking a walk in nature, taking in the beauty of the outdoors, and literally taking time to smell and enjoy the roses. Recognizing that this audience is probably full of caretakers, emotional rest will be a very important area to consider. This is the rest that we experience when we are in a setting where we feel that we need to be real and authentic of how we share our feelings. I like to use the example, and Lisa started with it before we even got started. She's like, how are you feeling today? Sometimes just asking that question and being with somebody you feel comfortable enough to be vulnerable about your feelings, that's considered your emotional rest as well. If you are in need of emotional rest, it's likely you also need a social rest. Sometimes you feel yourselves that you're in a social rest deficit because you're spending more time and energy in relationships that exhaust us as opposed to relationships that revive us. I know I've had relationships where being with a certain person, it can be really, really emotionally or physically or mentally draining. That could be where I need to reevaluate that relationship and be in the right state of mind when we're in that, where I might need some social rest. Or I'm with people who really revive me, who make me feel like, okay, everything is great and I really do get that social rest that I need. And then lastly, we have spiritual rest. And this involves connecting beyond the physical and mental to feel a deep sense of love, belonging, acceptance, and purpose. Spiritual rest is engaging in something greater than yourself, often through prayer, meditation, or even community involvement. So really taking time to rest daily is important to our overall health and well-being. And let's practice a couple of those in-moment self-care techniques that can help you access these types of rest. And before we do all that, or while we do all that, Corey's going to go ahead and explain a few other strategies for us.
Okay, so we've got a few minutes. And so I just want to introduce you to a couple of things, both of which some of you might be familiar with. And so the first one, for those of you who have not heard about it, may sound a little bit kooky, but go with us here. The emotional freedom technique was developed by Gary Craig back in the 90s. I'm all about the history today. And it is sometimes referred to as psychological acupressure or tapping. So if you've heard of it, you've probably heard of it as tapping. Tapping combines techniques from Chinese medicine and exposure therapy by pairing tapping on your own body with focused thoughts about a specific issue. So the basics, tapping is a simple and easy to use process where you tune into your body and mind, you speak a truth about how you feel right now, and you choose how you'd like to feel, all while tapping on specific natural comfort points. So basically this unique combination helps you shift your physical and emotional energy toward feeling really good. So I'm going to go through the basics. I don't know, we don't have a lot of time, but I'm going to make sure that you all know how to do it. And again, I have a friend who is a licensed counselor who walked Patty and myself through this at the Creating Connections conference. Some of you may have been there. There are a lot of really good YouTube videos if you want to learn more about it, and a lot of research evidence-based sites as well. So feel free to do some of that. But let's do some tapping for a few minutes here. So with 2 or 3 fingers, Patty and I are going to do it together, with 2 or 3 fingers on either hand, we're going to lightly tap with our fingertips on the locations shown in the diagram on your screen in a sequential order. As you tap, though, you'll repeat a phrase, what you consider your truth, to help focus on your targeted emotional and physical feelings. And this phrase often begins with even though, and should focus on you. So even though I feel anxiety, I deeply and completely accept how I feel. Or you might consider being more specific. Even though I'm anxious about the decision I need to make, I believe in myself and know I will make the decision that's right for me. Or here's a more specific example. Even though I'm worried about how to approach my supervisor with this situation, I deeply and completely accept and believe in myself to say the things that need to be said, right? We've all been in that situation. So using the same pressure you would use if you were tapping on a table to make a drumming sound, you want to make contact with your body, but not hurt yourself or cause discomfort. So I'll tell you all that I did this with my freshman class, my introduction to higher education class in the fall, and they were like banging on themselves. And I had to remind themselves, you're not beating a drum, you are tapping on your body. So don't hurt yourself, but we want to tap roughly 3 to 7 times in each location. So we start by tapping on the karate chop side of the hand, right? So tune into your body and mind, your emotions, repeat your phrase. It can be as simple as, even though I feel anxiety, I deeply and completely accept how I feel. Remember, you're going to do the karate chop, tap with your hand using your fingertips, tap, 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 tap. Next, we move to the top of the head and use the fingertips on one or both hands. There are a bunch of, so go ahead and tap, and I'm just going to talk you through. There are a bunch of energy points here. You can tap in the center, or you might find a spot, so experiment a little that feels good to you. Some people even use the flat of their hand to pat the entire top of their head. Now what you'll do is work down the body, and for the sake of time, we're not going to work all the way through, but you're going to go to your eyebrows at that point, located in the beginning of your eyebrow near the center of your face, the sides of your eyes next, under your eyes on the bones located under your eyes. Tap under your nose, roughly midway between the bottom of the nose and the top of the chin. The chin is next, and it's not really the point, the tip of the chin, it's midway between the bottom of the lower lip and the chin in that little indentation area. For the collarbone points, find the start of one of your collarbones. I have to always think about this, and move about 1 inch down and 1 inch outward toward your shoulders. So you can see on the little picture, there's a collarbone, and tap, 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 tap. These are really powerful points for stress and anxiety relief. And many people just use these collarbones right on the collarbone all by themselves when they feel anxious. And I found myself doing this a little bit more often. Often during Zoom meetings, nobody really notices that I'm just sort of leaning back and tapping on my collarbone. Then you want to go under the arm point, so you can reach across to tap your chest, reach across your chest to tap, or you might choose to lift your arm up and use the hand on the same side, kind of like you're doing a little chicken dance. And then often folks will return to the top of the head again and tap. So let's do that just now to feel complete. So then think about, how do you feel now? Have you been repeating your truth? And you know, if you want to share in the chat, you're welcome to do that. We're going to go ahead to the next one, just to walk through one more with all of you. And I really encourage you all to take some time to do this. And again, 5 minutes to do this for yourself. Okay, this one is a really important one, and a really, I want to say it's close to my heart, but it really is close to my belly when it comes to being a speech pathologist. So when you think about resting and regulating your bodies and your brains, we also can't go wrong with good old-fashioned belly breathing. And since many of us work or live with young children, we're going to share this technique in a way that you can practice for yourself and with a little one. This could be a bonus way to co-regulate with your child or with a family member or caregiver when you or they need to rest or need to just take an extra breath and take a moment. So something to keep in mind is that our natural breathing patterns should engage our diaphragm, but many people actually don't breathe properly. And when you breathe in, your belly should expand. When you breathe out, your belly should contract or move inward. I was listening to a podcast just the other day with this really well-educated person who said she just figured out, like the last couple of weeks, that this was how you're supposed to breathe. She talks a lot about being anxious and stressed out and overwhelmed. And I thought, well, maybe now that you know how to breathe, you can take a moment and help yourself with that. So Sally says the belly breathing is helpful. It really is. It helps me calm down and regulate my 8-year-old who tends to have a little more anxiety. He gets a little worked up and we can just take some breaths. He gets mad at me about it, but then when I realize he's doing it, I can see his whole body beginning to relax. So it's been shown to be highly effective as a calming strategy and for a variety of health reasons. Breathing is truly one of the most sensitive indicators or warning signs of stress because it's such a vital link between our minds and bodies. And having sufficient breath support and coordination is also important for speech purposes. So as an SLP or a service provider in early intervention or early childhood, this is a strategy that I love because it not only supports our stress levels, but also facilitates our ability or the ability of the children with whom we work to speak fluently and to use their voices more effectively. So I normally would tell you all to lie down or to sit back to practice, but I do want you to think about where your breath is going, where it's coming from. You should be able to watch your belly expand. I usually tell people to put a hand on your belly, right over your belly button, and a hand on your chest, and think about where the air is moving. Is it going all the way down down to your belly when you breathe in and expand. Don't suck it in, let it out. And then as you let out a deep breath, you should feel your belly contract as well. And Missy has even said she's used it with the kids as young as 10 months old. And they copy what you're doing and they watch you and learn. So thank you, Missy, for sharing that. So I'm gonna let Patty take it back over. We're gonna wrap up with just a few considerations.
All right, so we are running short. We have about 6 minutes left. If you had any idea, we did this session in 90 minutes at Creating Connections, and we ran out of time severely there too. Self-care is a hot topic, and there's a lot to talk about it. And when we get into the strategies, there's certainly, we want to make sure we give time for those strategies. So I'm just going to throw out that question there, but how do you participate in self-care at work? Go ahead and type into the chat. And how do you do self-care at work? And if you don't practice self-care at work, are there some strategies that we talked about today that you may incorporate now into your workday? I know as an early interventionist, I often was going in the car all day long between appointments and appointments. And sometimes there's 10 minutes drive from one to the next. It was nice to sit in the car for 5 minutes before I walked into the next house, right? So Marty says, dance party in my office. That's awesome. Work-life boundaries, fantastic. Dance parties are the best. That's fantastic. Corey's going to try this tapping, but a cup of tea or coffee often helps. Yeah, that's an answer I get quite often when I've asked about how we really are taking care of ourselves throughout the day. Coffee is obviously something that's very easy, particularly for those that are early interventionists that are driving around in your communities, for sure. So let's go to the next slide, Lisa, which talks about taking care of yourself outside of work. So yes, obviously we have our work lives, and that's maybe 40 hours out of our week, but we also have to think about how we're taking care of ourselves outside of work. And I love that Danning mentions work-life boundaries. I years ago developed that boundary that when 5:30 hits, my work phone turns off. Like I physically turn it off. And people know that they can't reach me outside of my work hours. Same with my email and things like that. I might check it, but I won't answer it. There's a boundary for me to kind of keep that separate. And it's also so I'm taking care of myself and those outside times. But some of the things that are listed here on the screen: connecting with family and friends, getting outside, which is huge. Fresh air for 5 minutes can do a world of good. Snuggling with your fur babies. Corey and I both have pets. So having those animals around can certainly be very therapeutic, but definitely a sense of self-care. Exercise, even 5-10 minutes of exercise can be better than no exercise at all. A nap, which is wonderful. And then Samantha, our colleague that worked with us this summer when we presented the session, added smelling babies. Who doesn't love the smell of babies? That is also certainly a self-care strategy as well. So we can move to the next slide, Lisa, to wrap it up. So one of the things I want to just make sure we mentioned as we wrap it up is one self-care activity per day. Make that commitment to do one thing per day to focus on your body, your mind, and your spirit. And the last thing I'm going to mention just before Lisa wraps us up today is their former colleague Dana presented a nice blog about lots of self-care tips related to her recent book. And Seth is going to drop that link into the chat box, but really kind of reiterates a lot of the things that we talked about today. But Dana's book, Pause and Reflect, also was really solely focused on work on early interventionists and the work that we do as early interventionists as well. So wanted to give her a little shout out because her blog was just perfectly in line with what we just talked about. So thank you guys for joining us. And I'm going to hand it back to Lisa to wrap us up.
Thank you, Patty and Corey. That was so wonderful and so much really good information. I put it in the chat too. I think I'm going to take those like 7 types of rest and really like be intentional and write down things that I can do for each one, since you kind of like mentioned that each of them are really equally important. So I think this was just phenomenal. Just so everyone knows, save the date for our next talks on Tuesday. It's actually, we're going to have another 2-parter in March and April, and it's going to be on autism in girls. Dr. Subarna Daria, she will be the presenter for those sessions. The advertisement for that and registration will actually go out tomorrow. So be on the lookout for that. Right now for today, in order to get your certificate, go back to your mailbox and check that. You should see a link to take the survey. Once you complete that link, the certificate will automatically populate for you, and you can download that certificate for your records. But if you have any questions for Patty or Corey, please feel free to go ahead and type that into chat. And we hope that you have a great day. And again, huge thank you to Corey and Patty. This was so helpful. So thank you.
Thank you, guys.
Thanks, everybody.